Welcome to Children's Dental Center. Hi, I am Dr. Olga Ordusar, a pediatric dentist. I joined this community of Everett, Washington back in 1992. It was my long dream as a child to be a pediatric dentist and to create an atmosphere for children where it can minimize their fears and it can just create something very unique where as an adult they can enjoy being a dental patient. This is our award-winning facility here in Everett, Washington again. Yes, we're about 15 miles north of Seattle, Washington. This tree right here, we begin in the waiting room where we have a mangrove tree. Mangrove trees are the trees that are in South America, and when the sea level goes down, the roots are exposed and the children can hang from it and play. And yes, indeed, children here can play and hang from the tree. Now, the idea behind the inside-outside space came from, I was born in Cuba, and I really wanted parents to experience with their families a more tranquil kind of facility where you can relax while your child is getting ready to go back and meet the dentist, and as a first-time patient or as a visiting continuous patient for years, enjoy a dental visit. Hi, we're back on tour. So here's our restroom, and our restroom is a very unique part of our office where we wanted the theme to follow through, and there's a little seat behind the door here that a mom can breastfeed or just sit and accompany their child to the restroom. Now, as we walk back through the office, we're now in the beginning of the clinical area. The clinical area begins with a little sign up here that says, "Happy memories begin here." I originally purchased this when I was in my teens, and I thought, God, I'm getting a little teary-eyed. I thought it would be great to have this one day when our dream becomes actualized and I can have kids walk in the door and truly know that someone's thinking of how wonderful their dental appointment can go. Hi, we're here in the oral hygiene room, and this is a very special room where kids can show us how they brush their teeth, or we can take time and teach them how to floss, how to brush, and how to care for their oral mouth. Hi, this is our open bay area. And in our open bay area is where we do most of our regular care for brushing and just introducing your child to dentistry. We have multiple chairs set up in a row, and the idea is to use this as a modeling center where one child can veer off another and learn how to have a good time. There's also a little table here for parents to come and join us if they like to watch and see what their child is experiencing at a time. Now, outside this huge clinical area that we have these rooms that we use for treatments, and they're right here. There's two of those treatment rooms. The treatment rooms were designed to be like tent areas where your child can come and be continuing the experience, but be by themselves. Now, there is a room back here that we call the general anesthesia room, and it's kind of an interesting one because we have a huge facility in order to accommodate for patients that have either major phobias that cannot be helped with light sedation, or very young children that have a lot of dental caries and need to be placed under general anesthesia or kind of like the sleep dentistry, and that way we can deliver a better quality of care for them in their particular situation. Now, the last part of our clinical area is what we call our teen option, and it's these two rooms back here that are more of a resemblance of what happens at a general dental office. And we graduate your child by age 18 or before that if they're ready to move on. Our goal is that we're in your life with your child as long as your child needs a pediatric dental experience, and as long as they need someone to alleviate their dental anxiety. And this is the end of our clinical tour. I spend a lot of hours here, so I wanted to be surrounded by a lot of my kids' artwork. Currently my kids are the preteen age and one is a teenager. So this is some of the artwork they did as a child, and I enjoyed it so much that I hung it up so that when they come to visit mom, that they feel that in my place there's a spot for them. Now I have a little bit more of this artwork that I'll show you, and it's in this hall particularly here. And if you look around, there's some of the things that they did as a child, as a proud mom anyways. It's kind of interesting. So we are now back at the front desk, and this is the end of our clinical tour and the tour for Children's Dental Center. Look forward to seeing you soon with your child or your children. Thank you.